Thanks a lot. Today is our second experience in having a next generation talks. The first one was last year, and I had also Farag for the same presentation, and I'm looking forward to extend this for the all upcoming events in not only vascular surgery, but all talks in all the conferences. Photodynamic therapy in wound care management. As you all know, it's a minimally invasive technique that utilizes a combination of photosynthesizing agent, light, and oxygen to produce therapeutic effects. You have to know the activation process, passing through application, accumulation, activation, then reaction. And I will stop now and give the mic to my younger brother, Dr. Farag.
Thank you, Dr. Sohiel, for this kind invitation. Actually, it all starts by the application of the photosensitizing agent over the wound or the infected tissue into which they were selectively absorbed and on exposure to the light with a specific wavelengths or the ultraviolet rays. It actually leads to the reaction of between the photosensitizing agent and the molecular oxygen to eventually produce reactive oxygen species, into which they will lead to killing of the antibiotic resistant strains, destruction of the biofilm and the abnormal or non-viable tissue with minimal damage to the surrounding healthy tissue that leaves a clean wound bed. So the BDT has shown promising results in the chronic non-healing wounds, infected wounds, and the biofilm, and in particular that the BDT has a valuable core or a value in either cases of the antibiotic resistance or even the cases of failure of the conventional therapy. Here at the time of this presentation, I would like to talk about the pros and cons of that modality. It actually has antimicrobial action without any systemic toxicity because it selectively targets the damaged tissue, and it is not only highly effective against the MDR organisms, but it also destructs the biofilm. And the thing here is that the BDT is considered as being repeatable, so we can reapply it multiple times with minimal or even no cumulative damage to the healthy tissue. And regarding the limitation, it is considered as being of limited penetration, so it would be effective, but only for the superficial wounds. And regarding the technical requirements, it actually requires a well-trained personnel in well-trained centers in a specific photosensitizer protocols. And at the patient level, actually, some patients may experience localized sensitivity to the light into the targeted area for a while post the procedure. So it's time, I think that it's the time to raise an important question, is that would it change our clinical practice? Actually, depending on the evidence-based medicine and on our current practice, the BDT is utilized as a supporting treatment rather than of being the first line management. But it actually worth adding it to our management plan as an adjunctive modality because it will enhance the efficacy of the standard protocols, especially in the complex cases. So my take-home message of my presentation today is that the photodynamic therapy represent a promising and a targeted approach in the modern wound care, particularly for the infected and the chronic wounds, with a unique ability to compact the biofilm and the resistant strains of organisms. That's all, and thank you.